Hello! Welcome to the third episode of Exploring Ethics Across Medicine. Today your hosts are me, Annika Mazika. I'm a fourth-year student at Arizona State University, and I'm majoring in biochemistry and minoring in nonprofit leadership and management. My goals in the future are to hopefully attend medical school and become a pediatrician or some other kind of PCP. Today, my guest is...
Everybody, my name is Colby John. I am a fourth-year animal science major here at Colorado State University. I'm working on my pre-veterinary requirements right now in hopes of attending vet school in the future.
Very awesome. I can't wait for it. A lot of school for us, but we're going to kill it.
Yeah.
But today, Colby is our veterinary liaison, for we are discussing the ethics of recording pet euthanasia appointments. So diving into today's article, imagine the heartbreaking and tender moment of having to take your beloved pet in for the euthanasia appointment. For the client and the patient, this is a very intimate and melancholic experience. Now, imagine being a veterinarian and wanting to maintain clear medical records for both yourself and the patient. And to do so, you record all your appointments, including the sensitive euthanasia ones. Today we will be exploring this ethical dilemma by evaluating the case presented to us by Jessica Pierce in Psychology Today in an article titled, Should Pet Euthanasia Appointments Be Recorded? Pierce begins her article through a case example of her friend who recently lost her dog, Hattie. Her friend stated she was unaware of any recordings happening during the appointment and would be uncomfortable if any did occur, despite Pierce being certain that they recorded all appointments. Her friend said the appointment was a blur and she couldn't remember the specifics of any intake form. Falling into evaluating both sides of the dilemma, Pierce presents us with why vets would record in the first place. For this, she interviews Dr. Kathy Cooney, a euthanasia veterinarian and founder of Companion Animal Euthanasia Training Academy, otherwise known as CAETA. Dr. Cooney believes recording all appointments offers protection for both the patients, clients, and the veterinarians themselves, as it provides specific records of what happened, how the clients were treated, if there are any adverse reactions from the animals, and finally, specific to the mobile vets, if there are any theft of any controlled substances. Dr. Cooney also states that while she lives in a one-party consent state, Colorado, she is sure to inform her clients through the online scheduling portal that all appointments are audio recorded for quality assurance purposes. As to the concerns these recordings pose on patients, these recordings may have an effect on patients' and clients' consent and privacy. First off, it is important ethically that all clients are notified that their appointments are being recorded, as not doing so is a clear violation of their consent. The question Pierce poses is if the current statements provided, whether on intake forms or on online scheduling portals, is truly enough to properly notify these patients and their clients. She draws back to her friend's case example of not taking notice of the intake forms and the emotional bearing of the appointment itself that may distract someone from being able to properly notice it. Pierce offers possible key wording changes, such as re-record all appointments by audio to ensure the safety of our staff and our patients. If you have concerns or questions about being recorded, please let us know. And notes any similar statements should be restated at the start of each appointment to hopefully bring it to patients' and clients' attention. So, is all of this ethical? Let's dive into it. But before we do so, the word of the week brought to you via, and I say word of the week, it's the word of the episode, but brought to you via Morrison and Furlong's book, Healthcare Ethics, Critical Issues for the 21st Century, 4th edition, is autonomy. Autonomy, meaning one is self-ruling, helps to ensure that the healthcare is patient-centered, as while a physician, or veterinarian in this case, may meet the standards of avoiding harm and increasing benefits, they must ensure that the patient's best interests are at the focus of their recommendations, and that patients must be included in decisions relevant to their medical care at every step. All right, so one last thing I want to touch base on before we dive into our discussion is I want to go over a couple important principles of veterinary medical ethics brought to you by the American Veterinary Medical Association. So a couple I brought up, and I'll just read them verbatim. It's available on their website. We have a veterinarian shall be influenced only by the welfare of the patient, the needs of the client, the safety of the public, and the need to uphold the public trust vested in the veterinary profession, and all shall avoid conflicts of interest or the appearance thereof. Another one is the veterinarian shall uphold the standards of professionalism, be honest in all professional interactions, and report veterinarians who are deficient in character or competence to the appropriate entities. Another one is a veterinarian shall respect the rights of clients, colleagues, and other health professionals, and shall safeguard medical information within the confines of the law. And lastly, a veterinarian shall, in the provision of appropriate patient care, except in emergencies, be free to choose whom to serve, with whom to associate, and the environment in which to provide veterinary medical care. With that being said, let's dive into the discussion. So, Colby, what do you think about this?
I personally think that from an undergraduate perspective, I really feel like we don't discuss a lot about the ethics of, the veterinarian and the client's relationship. I feel like in most classes we really talk about reasons why we would euthanize an animal, especially. Oh God.
No, it's okay. So you're saying like overall, like you're exploring the ethics of the actual procedures themselves, like what you're doing, rather than how you're interacting and like how you are recording stuff.
Yeah, and so I think this article really brings light to this topic that I feel like everyone should discuss. Students who are in veterinary school or undergraduates who are looking into veterinary school, and yeah, I think this article really sheds a light on the importance of ethical beliefs in veterinary medicine.
I agree. Yeah, especially like you said, the students coming in, like this is stuff they're going to really have to think about before they start like providing care.
Yeah.
On that note, how ethical do you think this is so far? Like, what are your concerns with it?
So far, so I have a different perspective. So I think that in a well-established, clinical environment, there are usually more staff on hand that could help with this procedure and also help write down key information during the appointments that maybe they don't need to be recorded as much. But in this article, it did mention that this is a mobile veterinary clinic, which means that it probably doesn't have enough staff or
Or maybe it does, but it's a different, you like you said, a different environment. They're going to the patient's
yeah.
homes. Yeah.
Yeah, so it's a different environment, which I think for liability reasons, if a veterinarian is like walking into, a client's home and doing like an in-home euthanasia, I feel like it is really important to record that information because it's not only protecting the veterinarian from, safety concerns walking into like a stranger's home, but it also could help the patient and the client in ensuring that whatever happens, is going to be recorded and yeah, just for liability and safety reasons. I feel like
Yeah, and like you said, like both mentioned in the article and by yourself, like this is really to protect both the veterinarian and the patient for liability. So like on the veterinarian side, like this is what was done, like this is what I did, this is what I said. So if anything, lest anything happens, they have that on record. But also they do it for the patient's best interest, so they can always refer to that. What happened last visit? What did we talk about? What was done like that may need to be addressed. Um, so, like you said, that's the benefits of this, like it's not just doing it just because the veterinarians need it. They're doing it for both, all the stakeholders, the animals they're serving, the patients that they're serving, or the clients, and themselves. So, but like you said, I think really the risk that come with it is like evaluating who's who's more at stake, I guess. So like I said, more established clinics, like they might have more people on hand. I have a job right now. I'm a medical scribe. Um, And so, like, I feel like, I think there are veterinary scribes. So if there's a more established clinic, they might have more people that are, like, readily available to, like, write down everything that records. So they don't even need to, like, manually, like, audio record or video record. But like you said, for those ones where they're going into patients' home and they, like, it might be kind of, it's going to be important to not, like, note stuff down, and having, like, the actual evidence there will help that a lot.
Yeah, I definitely agree.
But going into that, I think it is important that they consider how they integrate each thing. So if you are going to be audio recording, how do we protect the patient's autonomy? It's they can't choose if they don't know. So, and, like, obviously from the veterinary principles, their guide is, like, veterinarians really should be informing patients, like, every step of the way, what's going on, what's your care like, what are we doing. So do you think it's enough to just have that statement on that intake form, or, like, when you're scheduling an appointment, especially considering, like, how emotionally vulnerable, like, this kind of topic is?
Yeah, I personally agree, or I personally think that I don't think having it on a form that they fill out really does any good because, like you said, most of the time the clients will be very emotional and very, I guess, not really there in a sense because, they're losing their loved one or their, I guess you could say their child in some sort. And so I feel like before, the appointment or maybe even, when they walk up to the desk and check in, maybe having somebody mention again, like, hey, this appointment may be recorded, if that's fine with you, and then also stating reasons why this is going to be recorded because, most clients don't really know, and I think it's important to ask questions and to, keep saying like, oh, like, why do you need this recorded and stuff? So, yeah, I feel like more vocalization of the appointments being recorded and letting the clients know, even if it's multiple times, at least they don't have to like read it and then forget about it. So I don't know.
No, I totally agree. I mean, like, when I go to the doctors, like, I do skim the forms, but that's it. Like, I skim them. So, like, if it's not clear, people might miss it. And, like, I totally agree. Like, I honestly think the more information, the better, because I'd rather be more informed about what's happening, especially, like I said, like, during sensitive information, this kind of what's going on, than not know at all. Um,
Yeah.
yeah. But yeah, as you were saying, like, I think it's so important to have that discussion, to be able to, like, offer that discussion, not just dive in like, this is what we're doing and I hope you're okay with that. Like, they really need to say, like, this is why we're doing it. It's not just for our benefit, it's for your benefit. These are the risks that are involved, and this is the minimal risks that are involved, hopefully. Because it is important, because this is sensitive information. What happens if it gets leaks? Like, how are they protecting it? But as you said, like, there's so many benefits to why they would record this, but that needs to be relayed to the patient in order for patients to make their well-informed decisions and give their consent in the end.
Yeah, I definitely agree that, you know, it should, I mean, obviously it's really important for the patient, but also it's important that the veterinarian and the client have clear communication about certain topics because, like you said, this is very sensitive, and this could be very sensitive information that the clients are the veterinarians getting from the client, and so yeah, it's really important to establish a clear communication between them two, and also being a veterinarian, you have so much knowledge that a normal person might not really know, and so I think making sure that the client knows different terminology and knows different procedures and knowing why that this could be recorded and like why this could be helpful in the futures. Yeah, I feel like is really important.
I definitely agree.
Okay.
And not only that, it's important to know, like we were talking about this before, but like the relationship between the client and the veterinarian, and then furthermore into the public, that's really going to depend on how they handled the situation. In that case study given by us, by Pierce, her friend didn't know and she wasn't aware. I mean, like I said, like that grief, like kind of like just took over her mind in the moment when she was taking over the paperwork. So if she did go back afterwards and asked, was that appointment recorded? There could be a possible lack of trust going forward, and maybe she won't trust veterinarians. I mean, like that could be like the worst case scenario. Or as she wasn't able. Like I said, ethically, her autonomy would have been violated because she didn't know. I mean, she agreed, but she didn't know. But like it's so important that this. I think ethically it is justified, but the biggest thing is it has to be well informed to not only protect your patient's autonomy, but to like establish trust and a proper relationship that's going to expand in the future.
Yeah, and like you stated before, reading the AVMA, a veterinarian shall respect the rights of clients, colleagues, and other health professionals, and shall safeguard medical information within the confines of the law. So, yeah, I feel like that's really important to be
Amen.
informed and and inform the clients. So,
I agree. And then I think a subsequent discussion that might have to be discussed later is like, how are we keeping that information? What are we doing to make sure that that information is not getting leaked? Because, it's one thing just to have the records themselves, but it's another thing to actually have audio and video of like people talking and interacting, especially in the patient's home. So there's a lot of like, I think there's a lot of room to develop this and make sure it is as ethically sound as possible. So not only is like everyone getting the most benefits, but we're minimizing the most risks.
yeah, I definitely agree.
Well, on that note, do you have any final thoughts before we end our discussion?
I guess my final thought will be, at the end of the day, the client is always right and should always be
Yeah,
should
should
always
all.
be heard for and taken. Yeah.
Yeah, taken care of, informed. Like I totally agree.
Yeah.
Because I mean, like when you become a doctor, you become a vet. You're doing it for these people. You're doing it because you want to help them. And so taking those steps to minimize any risk that might come to them and like hopefully expand and like establish like great care with them is going to be vital.
I agree.
Well, thank you so much for joining me, Colby. I loved our discussion today. Like you said, this is a really interesting article because and like you said, for people coming in, like it's very important how you're going to be thinking about how you're interacting with patients, how you're even like doing the paperwork. Like, what are we saying? Like, how are we going to have that discussion beforehand? Are we going to have that discussion beforehand? Um, this is a great article. I was very interested in it.
Yeah, thank you for having me and um letting me help you with your discussion. So,
Yes, thank you for offering the great insight of your undergraduate experience, and I can't wait to see how we develop in the future um, with both our smart brains in our practices and our ethical like superpowers.
I agree.
All right, well, thank you for joining us for the third episode of Exploring Ethics Across Medicine. This will be our last third burst episode, if that makes sense. So this is our initial coming out series, coming out in threes. So if you are interested for any of the things mentioned in today's podcast, they will be listed in the description with the resources or the citations and the links. So go ahead and click on that if you're interested and let us know what you guys think about this topic. But otherwise, we're closing out. Thank you for joining us. All right. Bye.